Hi everyone, welcome once again to AARC's Big Ideas Theater. I'm Ed Hyland. I'm joined now by Stephanie Williams. She's here to talk about a very serious subject and one very important to respiratory therapists, end-of-life discussions for a respiratory and from a respiratory therapist perspective. Stephanie, thanks for joining us.
Thank you.
We're just talking a little bit about, kind of the differences here between, say, palliative care and hospice. Can you first start with that?
Sure. So I think there is a lot of confusion about palliative as opposed to hospice, and palliative care is something that can occur at the same time that curative care is happening. So it really should start very early in the treatment process, providing extra support, providing extra resources to a patient, and it can continue on and on until the patient and the family decides that they no longer desire to pursue curative medicine, and then that would transition into a hospice care. So hospice care is always palliative, but palliative care is not always hospice.
Okay.
So.
And drawing that line, is that become a family decision, or does that become a medical decision, or both?
Generally, it should be made in conjunction. The family should be making that decision with the patient's interest in mind, along with the healthcare team. Those are big decisions. They're often tricky decisions. Patients don't want to let their family think that they are giving up or let their families down, and families conversely don't want the patient to think that they've been given up on either. But one of the things that I like to keep in mind is that we plan for absolutely every other stage of our lives. We plan for weddings, we plan for babies, we plan for new houses, but we don't plan for what is ultimately the biggest change of our lives. And this is a discussion that should be happening very early.
I've experienced, sadly, but I've experienced, hospice care, in my
Yeah.
family. I've known many other people with hospice care. It's always been a very positive and frankly uplifting type of experience. Why do you think there's still so many negative, attitudes out there about it?
I think that for the most part, people have this vision of hospice as the nurse that comes in with the large dose of morphine that just eases the patient out, as if that is all we can do for the patient is just ease them out of this world. And ultimately what hospice is doing is preserving the dignity and creating the very best quality of life for a patient in the circumstances that they are finding themselves in. So I think if we can ever educate the public and educate ourselves, quite honestly, that hospice is more than just that last dose of morphine, that it really does provide an increase in quality of life, I think we'll be making strides in the right direction.
Some of the other benefits of hospice, perhaps? I know one, frankly, is it's a much more comfortable environment than a hospital.
It certainly is. Many times we can provide hospice care at home, so the patient is in a familiar setting, near their family and friends, and I think that's a great benefit. Some things that people don't generally realize is that hospice, when they are called in, they begin to pay for all the medications. They pay for any hospital type equipment medical equipment that needs to be brought to the home. They will also pay for respite care for a caregiver for up to 5 days at a time. And I think, caregiver fatigue is real, and it's something that we don't talk about a lot. But when that person needs just a break for whatever reason, they'll actually pay for respite care to come in and take care of the patient so that caregiver can have a small break.
And this fits into the insurance scheme, so to speak, in terms
Yes.
of hospice getting paid for so they can provide these services.
Correct, that's correct. And then another thing that a lot of families don't recognize is that a year after the person passes away, they provide social work and support and oftentimes counseling for the family that's left behind. And I think that is a very real need that is being met by them.
And just a final note on your respiratory therapist, give us some thoughts on helping a family, helping a patient perhaps, to make that transition. I mean, you've already got so much on your plate just caring for the patient.
Right, but I think in general, we find ourselves in a unique position that we are the experts on this respiratory disease that's happening to this patient. We kind of already know what comes next. And if we can help to educate our patients to say, we want to empower you to make the very best choices for you. We want you to be comfortable. We want you to remain in control for as long as you possibly can. Let us help you make that decision. And it starts with just having a conversation about their goals and their wishes.
Those end-of-life discussions for
Absolutely.
a respiratory therapist.
Yes.
Thank you so much, Stephanie Williams, for joining us.
Thank you.
And this is the Big Ideas Theater, brought to you by Draeger.